Hello everyone and welcome to my virtual oral presentation. My name is Manuela Malek and I work as a research assistant at the Chair of Nursing Science at the University of Wittenherdecke, and I'm working in the collaborative interdisciplinary project Meine Truhe, My Individual Digital Education. Today I'm excited to share with you our interdisciplinary project's progress and findings of the interprofessional user-centered prototype evaluation for building individualized digital education in dementia healthcare supported by artificial intelligence. Meine Truhe is funded by the Federal Ministry of Education and Research and operationally supported by the Federal Institute for Vocational Training with 8 partners. The consortial leadership has Medic und Ruhe. We have technic partners Tutuyu and Fraunhofer ISST and practice partners Alfred Krupp Hospital, such as the hospital and long-term care facility Gute Hoffnung. The project aims to research and develop an automated delivery system for individualized digital learning content using artificial intelligence, specifically tailored for professionals in dementia healthcare. The University of Wittenherdecke is one of the partners and a collaborative effort between 2 chairs, nursing science and didactic and education research in healthcare. Our primary goals include preparing dementia-specific content and the needs of healthcare professionals, creating a learning preferences matrix, iterating on prototypes, and implementing these innovations through a practical example, behavioral change in individuals with dementia. In this presentation, I will focusing on the 4th work package, which deals with the following research question. How can current learning content be prepared in such a way that different users can choose different learning paths according to their preferences and learning needs? To answer this question, we adopted a qualitative study design, employing focus groups, co-design workshops, and expert audits. The study fit into the first phase of the DIDI framework for design and evaluation of digital health interventions. The project has been running for 2 years, so we have already done a lot. In the first step, we conducted focus group interviews with professionals actively involved in dementia care to explore knowledge and needs of their learning preferences. Based on the results, our technic partners created the digital learning nuggets. This is the second step. Now we are here. After that, co-design workshops and expert interviews were conducted to validating the content of the learning nuggets. The participants in the co-design workshops worked through the prototypical learning nuggets with the test accounts. The first step involved intuitive processing in which the participants behaved as if they were using the learning nugget in the real situation. Subsequently, content-related and didactic questions were asked that focus on the experiences of the participants, and while the participants were performing and answering the questions related to the various tasks, the interview was audio recorded. How exactly did a co-design workshop look like, or rather, how does a learning nugget look like? We had a total of 8 prototypes with different content and prepared in different ways. On the slide, you can get a little insight of the learning nuggets. They were learning nuggets with video, with audio, practical tasks, or a virtual colleague, and content about dementia communication techniques, or about Alzheimer disease, or about challenging behavior. The exchange with the colleagues is highly valued in practice which is why we have represented a virtual colleague as an avatar for the learning nuggets. One learning nugget is about 5 minutes. Data was analyzed using content analysis. Our co-design workshops involved 39 participants from various professions, including nursing staff, inpatient, geriatric nurses, inpatient and home care, medical doctors, nursing students, physiotherapists, housekeeping staff, and hospital serving staff. And here are some key findings from our research. Data shows that practice-oriented content and concrete strategies in daily work is preferred, and participants assess that learning nuggets are easily to integrate in daily practice and to refresh knowledge permanently. The learning time is up to 20 minutes and the learning location is variable. The implementation of the digital colleague receives very good and positive feedback. Now, finally, here are some points for the discussion. The evaluation of the prototypical learning nuggets is an important step in order to identify and address the learning needs of the users. Practice-oriented learning content applies learners to implement what they have learned in their daily work and to optimize their learning process. Recognizing that learning nuggets help to keep knowledge refreshed emphasizes the importance of continuous education. And this can help to prevent knowledge gaps and support long-term professional development. In conclusion, our project Meine Ruhe is making significant strides in the development of individualized digital education for dementia healthcare professionals. We are committed to creating practical, user-centered solutions that leverage artificial intelligence to improve, hopefully, dementia care. Thank you very much for your attention and watching this presentation. I'm looking forward for your questions. You can leave comments at this platform and you can also follow us on Instagram. Bye and best regards from Germany.